He saw the downcast eyes and worn scrubs. He didn't see the scars on her hands shaped like shrapnel wounds. He didn't see the legend of Sangin sewn into her jacket lining. Sacred Heart Hospital in Portland smells like antiseptic and floor wax and something underneath, copper, maybe, or the ghost of old blood no amount of bleach can fully erase. The fluorescent lights hum their constant electronic prayer over sterile white corridors and rooms where people come to break and people come to heal. Elena Martinez, 42 years old, moves through the ICU at 6 in the morning with the kind of quiet efficiency that makes noise seem unnecessary. Her movements are precise. Economical. She wastes no motion, no words, no time. Faded navy scrubs. Hair pulled back so tight it stretches the skin at her temples. A hospital badge turned backwards so no one has to see her photograph. She has worked at Sacred Heart for exactly 3 years, the kind of 3 years where you show up, you do the work, you leave, and nobody asks questions about the gaps in your resume or why you never mention family or where you came from before you arrived in Portland with a single suitcase and a reference from someone who no longer answers their phone. In her locker, beneath the spare scrubs folded with military precision, sits a cracked ceramic mug that reads "World's Okayest Nurse" in faded letters. A dying succulent in a clay pot, brown at the edges, still reaching for light it can't quite find anymore. And a worn military jacket, navy blue, the kind they stopped issuing 15 years ago. The jacket hasn't been washed in months. She hangs it the same way every shift, her hand moving to the inside lining before she closes the locker door, fingertips finding something stitched there, a small patch, faded and soft from years of being touched. She never lets anyone else see it. Not quite. The ICU at 6 in the morning has a rhythm that doesn't exist during the day. The machines beep their steady electronic heartbeat. The ventilators wheeze their mechanical breath. The nurses move like ghosts between rooms, checking lines and doses and the small miracles of human bodies that stubbornly refuse to quit. Elena checks vitals on a post-op cardiac patient in room for 12, her hand steady as a surgical laser as she adjusts the 4-drip, reads the monitor without looking at it for more than 2 seconds. The numbers are information. The beeping is a conversation. Pain is data, and she reads data like other people read newspapers. In room for 18, a trauma patient from yesterday's motorcycle accident is waking up, confusion bleeding into his eyes. Elena sits beside the bed for exactly 40 seconds. She has timed how long it takes to calm a disoriented patient through voice alone, through presence alone, through the kind of steady certainty that comes from having already survived the worst. She doesn't touch him, not yet. You're at Sacred Heart Hospital in Portland. It's 6:15 in the morning on a Tuesday. Your name is David. You were in an accident. Her voice is low, pitched to carry no anxiety, no emotion, just information. The patient's breathing slows. His eyes focus. He nods once. She stands and leaves. No unnecessary words. No false comfort. Just competence. That's when the new attending comes through the double doors, and something in the ICU changes before he even speaks. Dr. Marcus Sterling moves like a man who has never questioned his right to occupy space. Expensive shoes, Johnston and Murphy, probably $300, clicking against linoleum like a countdown. Pressed white coat with his name embroidered in blue thread. His hair is silver at the temples in a way that looks intentional, like he has it styled that way specifically so people will associate him with trust and authority. He is 58 years old and carries himself like a man who has never been wrong in his life, or if he has been wrong, no one has ever had the courage to mention it. He scans the ICU with the expression of a general surveying a battlefield, looking for weakness, for gaps in the line, for someone to diminish. Elena doesn't look up from the medication cart where she is verifying doses. She has learned, in 3 years of careful observation, that the moment you make eye contact with men like Sterling is the moment they start building narratives about you. She keeps her eyes on the vials. 5 milligrams lorazepam. 10 milligrams morphine sulfate. 2 milligrams hydromorphone. The names are sounds to her, almost rhythmic, almost meditative. Who's on that patient? Sterling says, not looking at her, talking to the charge nurse at the station. Elena Martinez, the charge nurse, says, not looking up either. There is a texture to her voice that Elena recognizes. It's the voice people use when they're trying not to make something matter. Sterling's eyes move across the ICU until they land on Elena. His gaze is like a spotlight that makes everything it touches feel exposed. She can feel the weight of his attention the way soldiers feel the pressure drop before an explosion. Something in her body recognizes what this is. Threat assessment. Hierarchy establishment. The ancient calculus of power and submission. But she doesn't flinch. She doesn't look up. She finishes verifying the medication in her hands and marks it on the chart with a pen that moves across the paper with careful precision. The scratch of pen on paper is a small sound, almost nothing, but in this moment it feels like a refusal. Like a statement. Sterling watches her for 6 seconds. Elena counts them the way she counts everything, and then his mouth moves into something that might be a smile if smiles could be weapons. That one your assignment? He asks the charge nurse. She's been on the day rotation since you implemented the new. I'm asking if she's competent or just present. Sterling still isn't looking at Elena. He's still talking about her as though she's furniture, and there's a method to this, Elena understands. This is how men like Sterling establish dominion. Not by confronting. By making it clear that you're not worth confronting. The charge nurse doesn't answer immediately. Elena can hear her thinking. Can hear the weight of workplace politics settling into her silence like silt in still water. Elena's reliable. Her patients recover. Her charting is. Competence is table stakes, Sterling says, turning toward the coffee station. What I need to know is whether someone understands the hierarchy of authority in my hospital. My hospital. The ICU doesn't change. The monitors keep their rhythmic beeping. The 4 pumps keep their mechanical hissing. But something has shifted, like the barometric pressure dropping before a storm that everyone can feel coming but nobody wants to name. Elena continues her work. Room for 16. Room for 17. Room for 19. She moves through the morning with the kind of focused determination that makes time feel like something she controls instead of something that controls her. She doesn't think about what Sterling said. She doesn't think about the way the other nurses suddenly became very busy when he arrived, the way conversation stopped, the way the ICU compressed itself around his presence like a fist. Instead, she thinks about her patient in room for 12, whose cardiac output is improving in measurable increments. She thinks about the parameters on the post-op trauma case, the way his oxygenation has climbed from 88% yesterday to 94% this morning. She thinks about the conversation that isn't a conversation, the one written in numbers and waveforms, and the steady climb toward recovery. At 11 o'clock, she is changing a dressing on a patient with second-degree burns when Sterling appears in the doorway. He doesn't knock. He doesn't announce himself. He simply appears, like something that was always going to be there, and watches her work. The patient is a woman, maybe 50, her forearm wrapped in gauze and topical antibiotics. Elena unwraps the dressing with hands that don't change their rhythm, and underneath, the burns are pink and raw and healing exactly on schedule. Impressive, Sterling says, but the word sounds like a question. Elena doesn't look up. She applies new gauze with precision, her movements economical and sure. Keeping the dressing clean. Monitoring for signs of infection. Standard protocol. Is that a criticism of my protocols? She finishes the dressing before she answers. The patient watches them both, caught between 2 people speaking the same language in completely different ways. Elena tapes the final corner of gauze in place, and then she does look at Sterling, and her eyes are flat and dark as a tidal pool. No, doctor. I'm reporting on the patient's progress. He smiles again, that smile like a weapon in a holster. Good. Keep it that way. He leaves as suddenly as he arrived, his footsteps clicking down the corridor in a rhythm that sounds like a threat. At lunch, which Elena doesn't take, because she learned years ago that eating on a schedule requires a kind of normalcy she no longer possesses, she sits in her locker room alone. The staff cafeteria is where the other nurses migrate, where they talk about shifts and schedules and the small accumulated grievances of working in a hospital. Elena eats a salad she brought from home, standing up, her back against the lockers. She reaches into her jacket hanging above the bench. Her fingers find the patch without looking. It's the size of a postage stamp, worn cloth in shades of blue and gold, embroidered with an anchor and an eagle and letters too faded to read anymore. The unit patch from Sangin. From the schoolhouse. From the 7-year-old boy whose father wore this same insignia on his sleeve, who was buried under concrete and rebar and the dust of 17 years of occupation, who Elena pulled from the rubble while bullets cracked overhead like a conversation in a language she understood perfectly well. She holds the patch for exactly 4 seconds. Then she tucks it back into the lining, smooth and careful, the way you would handle something that might shatter if you weren't gentle. Her hand presses against the jacket lining, and she can feel her own heartbeat in her fingertips, the pulse of someone who is still alive when she probably shouldn't be. The locker room door opens and another nurse, Jessica, young, new, still believes that kindness is a viable professional strategy, sees Elena standing with her hand on the jacket. "You okay?" Jessica asks, and there's genuine concern in her voice, which makes Elena recognize, again, why she doesn't talk to people. Concern requires reciprocal explanation. Kindness demands honesty. "Yes," Elena says. Just remembering something. What she doesn't say, that 3 years ago she left the Navy because the nightmares had become unbearable. Because she could no longer trust herself with a weapon. Because she knew, with the certainty of someone who has held a loaded gun and felt the weight of deciding whether to use it, that she needed to disappear. To become someone unremarkable. To work in a place where nobody asked questions, where she could help people heal without having to explain what had broken inside her that no amount of medical training could fix. What she doesn't say, that at the moment Dr. Sterling walked into her ICU, something in her recognized the shape of someone who had never had to choose between 2 unbearable options. Someone who had never held a 7-year-old boy's hand while screaming for a medevac helicopter. Someone who carried authority like a costume instead of like a weight. By 3 o'clock, the shift is winding down. Elena completes her documentation, charting that is precise and thorough, the kind of charting that makes it difficult for anyone to find a flaw, though Sterling will eventually try. She updates her patient's family members. She hands off the night shift with information that flows like a river, complete and detailed and professional. As she leaves Sacred Heart's entrance at 4:28 p.m., her scrubs replaced with jeans and a long-sleeved shirt that covers her hands, the Portland rain has begun, a soft, persistent drizzle that falls with the patience of something that knows it will eventually wear everything down. She walks to her car, a 14-year-old Honda Civic with 187,000 miles on the odometer, and sits in the driver's seat for exactly 3 minutes before starting the engine. In her apartment, a small one-bedroom in a building nobody particularly remembers, Elena hangs her jacket in the front closet, her hand finding the patch one more time before she closes the door. And in his office on the 7th floor of Sacred Heart Hospital, Dr. Marcus Sterling sits at his mahogany desk and reviews the personnel file of Elena Martinez, finding himself unable to articulate exactly why her competence felt like an accusation. But that night, he will make a note to himself, monitor this one. Something's off. Need to establish who's running my ICU. The patient's face had turned grey. Elena stood at the bedside of James Crawford, post-op from spinal fusion surgery 6 hours prior, watching his shoulders tense with each shallow breath. The heart monitor beeped its steady rhythm. His wife and daughter sat in the vinyl chairs beside him, both leaning forward, both watching his eyes squeeze shut against pain. Elena checked the clock. 16 minutes overdue for his scheduled morphine dose. She pulled up his chart on the computer mounted to the wall, scrolled through Sterling's handwritten order in red ink, hold all opioid dosing for 48 hours post-op, monitor for drug-seeking behavior. The note was time-stamped for AM, before Sterling had even seen the patient. Before he knew Crawford was a decorated Marine who'd been wounded twice in Anbar province and had legitimately been off pain medication for 3 years. Pain was information. Elena had learned that in Sangin when she watched medics deny morphine to Marines with sucking chest wounds because someone up the chain had decided the unit's budget for opioids was running over. She'd learned it again in the years since, watching patients suffer because protocols written by doctors who'd never held a bleeding soldier's hand had been weaponized into dogma. Crawford's daughter grabbed her mother's hand. "Mom, he needs something." Elena approached the bedside. "Mr. Crawford, your oxygen saturation is dropping because you're guarding your incision. If we don't manage this pain, pneumonia sets in, and you'll spend another week in here." "I know," Crawford whispered. "Sterling said I'd end up addicted if." "I'm going to talk to the doctor," Elena said. Not a request. Not apologetic. Just fact. She found Sterling in the hallway outside Trauma Bay 2, reviewing a chart with the resident who'd been rotating through for 3 weeks. Sterling's voice carried the particular cadence of a man establishing dominance, clipped, dismissive, designed to make the younger doctor feel small. When he saw Elena, his expression shifted into something that resembled attention the way a predator resembles interest. Nurse Martinez. Problem. Crawford's pain protocol. His post-op vitals are unstable because he's splinting. He needs. Mr. Crawford is a morphine seeker who needs tough love, not enabling from someone playing hero. Sterling said it loud enough that a family group standing near the waiting area turned to look. A woman in a cardigan clutched her purse tighter. Doctors write orders, nurses follow them. That's the institutional respect this hospital is built on. Perhaps you missed that memo. Elena felt the silence form around them like water. The younger resident looked at his shoes. A dietary aide pushing a cart suddenly needed to concentrate very hard on the floor numbers. His surgical pain is acute, Elena said. Her voice had dropped an octave without her deciding to. Not behavioral. Step back, Nurse Martinez. Sterling turned away from her, addressed the resident. This is what happens when nursing staff exceed their scope. She's looking at post-op vitals and seeing a medical emergency instead of normal anxiety. This is exactly why we have physician-led protocols. Elena walked back to Crawford's room. His wife was crying now, quietly, the way women cry in hospitals when they've learned that hope requires permission from authority. Crawford's hand trembled as he gripped the bed rail. Elena checked his oxygen saturation. 88% and dropping. His blood pressure had climbed to 164/98. The surgical incision was beginning to show stress, the skin around the stitches flushing red because his muscles wouldn't relax. "Mr. Crawford," Elena said. "I'm going to document this vitally unstable state." On the unit board. In front of Sterling. And when? But Sterling was already there in the doorway, his shadow falling across the bed in a way that made Crawford's wife flinch. "Nurse Martinez, perhaps you need a moment outside." Sterling's voice was a tank idling in a garage, low, powerful, designed to make everyone within earshot understand that he could crush them if he chose to. He looked at Crawford's family. "Your wife is experiencing some confusion about her role here. It's common when staff members haven't received adequate mentoring." He pulled out his phone. Elena watched him type, knew exactly what he was doing. The unit board was a whiteboard in the main nursing station, visible to everyone, updated by whoever felt authorized to humiliate someone in real time. She'd seen names written there before, usually nursing assistants who'd made a mistake, always accompanied by a symptom, lateness, attitude problem, needs retraining. Sterling walked directly to the nursing station and wrote in bold marker, "E. Martinez, insubordination and exceeding nursing scope." The break room would be hostile by lunch. Elena knew this the way she'd known, 20 years ago in Sangin, that the schoolhouse was about to collapse before the first crack appeared in the concrete. Over the next week, it unfolded with the precision of a military operation designed to isolate an asset. The break room phenomenon began the very next morning. Elena arrived at 7 a.m., grabbed her lunch from the refrigerator, sat at the corner table where the nurses usually gathered. Within 90 seconds, the room had emptied. The orthopedic RN who'd been joking about her weekend plan suddenly remembered she needed to check on a patient. The ICU nurse who'd been scrolling through her phone stood up, grabbed her granola bar, and left without eye contact. By day 3, Elena brought her coffee and stopped expecting company. She'd sit, unwrap her sandwich, watch the door. A parade of colleagues would enter, see her, and reverse direction as if the room had become toxic. Her coffee grew cold in the silence. Nobody sat near her. Nobody asked her to cover a shift. Nobody stopped by her locker to chat. The whispers came next. Elena heard them in the medication room when she thought she was alone. Sterling's pet project, one of the newer nurses called her. She thinks she knows better than the doctors. That same nurse, Jessica, who Elena had trained on the medication dispensary 2 months earlier, who Elena had covered for when her daughter was sick. The problem, another voice responded, loud enough to ensure Elena heard it while collecting supplies. Sterling executed the next phase during morning rounds. He reviewed her chart notes from the previous shift, sighing theatrically at each one. Some nurses, he announced to the gathered residents and attending, seem to believe that protocol is merely a suggestion. That their clinical impressions override physician orders. He tapped his pen against her documentation. This is what happens when we allow nursing staff to operate without proper oversight. They develop an inflated sense of their competence. The resident, a young man named Foster who'd seemed sympathetic during shifts, looked away. Nobody disagreed with Sterling. Nobody ever did, not out loud, not in front of the attending who could flag their evaluations. By day 5, Sterling escalated to direct confrontation. Elena was stepping out of the ICU when he appeared, blocking her path with the casual physicality of a man who'd never been told no. His voice carried into the waiting area where families sat with their phones and their prayers and their desperate hope that their loved ones would survive this place. Your concerning lack of institutional respect is documented now, Martinez. You've got this. He gestured vaguely at the unit board, which now bore 3 separate entries about her performance. You don't belong here. You're a liability to this department. Elena stopped walking. Didn't step back. Didn't step forward. What are you hiding in that employment history anyway? Sterling's voice had taken on the tone of a man probing a wound to see if it still hurt. 3 years at Sacred Heart and nobody knows where you came from. No references. No social media. Sparse work history before that. You almost seem like you're running from something. The fluorescent lights above them hummed their electric song. A visitor walked past pushing a wheelchair. The ventilation system whispered cold air through the vents. Elena let one tear escape, just one, controlled, purposeful, and wiped it without breaking eye contact. The tear was a calculated thing, a tool, not a break. I've seen what real authority looks like, Dr. Sterling, Elena said. Her voice was quiet enough that the visitors in the waiting area had to strain to hear it. Quiet enough that it sounded like a statement of fact rather than a challenge. And this isn't it. Sterling's face reddened. His jaw clenched. He opened his mouth to respond, closed it, turned away as if dismissing her would undo the humiliation of being outmaneuvered by someone he'd assumed was already broken. But that wasn't the worst part. Sterling had already begun making calls. Board members received carefully worded emails about nursing staff exceeding scope. Investigators appeared the next morning, requesting her employment files, her references. Elena watched them write down the names of the carefully constructed aliases she'd built into her past, contacts who existed in phone records but whose numbers now routed to fake voicemail systems that hadn't worked in years. The investigators' questions became more pointed. Where exactly had she worked? Why were there gaps? Why couldn't they find anyone who remembered her? Sterling leveraged his connections with surgical precision. He had influence with the hospital president. He had friends on the board. He had cultivated relationships with people who made decisions about employment. Each call was brief, each one carefully calibrated to plant doubt without making direct accusations. Competent, certainly, he'd say to whomever picked up. But there's something about her work history that doesn't quite add up. I'd hate for Sacred Heart to have liability issues if she's not who she claims to be. Elena could feel the institutional machinery beginning to turn against her. The way Sterling had engineered it, the way his network responded, the inevitable grinding of bureaucracy once it had been pointed in a particular direction. She'd seen this before in different contexts. The predetermined outcome that masquerades as justice. The institutional drowning disguised as policy. Then the overhead announcement crackled through the hospital's speaker system. Trauma incoming. 30 minutes. Navy SEAL. Training accident. Sterling's head snapped up. Elena heard it from the unit's break room, where she'd been sitting alone with her cold coffee, and her hands went rigid around the mug. Navy SEAL. The statistical probability was astronomical. There were thousands of them across dozens of bases. Thousands of possibilities that this wasn't. But she already knew. She could feel it the way a compass needle feels north. The way her entire nervous system had just recognized something fundamental. The patch in her jacket lining, sewn inside the inner pocket where she'd carried it for 2 decades, suddenly felt like it was burning against her ribs. 20 years of distance. 20 years of silence. 20 years of trying to bury Sangin beneath scrubs and double shifts and a name that didn't belong to her anymore. And now he was arriving by ambulance. The ambulance bay doors burst open and the world compressed into 45 seconds. Paramedics wheeled Lieutenant Marcus Webb through the trauma entrance on a screaming gurney, his chest heaving with the irregular gasping of a drowning man who hadn't yet realized he was drowning on air. Chest trauma. Post-mission vitals check gone catastrophically wrong. The paramedic's voice cut through the hallway noise like a blade. Tension pneumothorax, left side, oxygen saturation dropping, started at 94, now down to 78, we've got 2 large bore 4s running normal saline, transport time 12 minutes, patient was conscious at pickup, alert and oriented times 3, vitals unstable and deteriorating. Elena heard the overhead announcement and her hand stopped moving. The chart she'd been holding fell to her lap. Sangin. The name made the scar tissue on her palms contract as if remembering its own history. She didn't move. She didn't breathe. Not visibly. Inside, the old neural pathways, dormant for 20 years, fired like synapses remembering their purpose. The boy. The schoolhouse. The faded patch sewn into her jacket lining in her locker 2 floors below. No. Not possible. Not here. But her feet were already moving before her mind caught up. The muscle memory of triage ran on its own circuit, the emergency response zone near Trauma Bay 2, where Sterling was already positioning himself at the head of the team, his hand steady and his face arranged in the expression of a man about to perform brilliance for an audience. He hadn't seen her yet. He was too busy reviewing Webb's chart, his manicured fingers brushing across the printed vital signs as if he were a concert pianist about to begin a performance he'd practiced 1,000 times. Elena slipped into the controlled chaos at the periphery of the trauma bay. Nobody noticed the worn RN badge clipped to her scrubs. Nobody noticed that the nurse they'd been trained to ignore for the past 3 months was moving with the precision of someone who'd done this calculation before, who'd done it under fire, under rain, under the weight of decisions that killed or saved. Sterling had already begun his protocol. Supplemental oxygen, he called out, his voice carrying the practiced resonance of authority. Get me a chest X-ray, portable unit in here, and somebody find me a thoracostomy tray. We'll reassess after imaging. He turned to Webb, who was gasping like a fish on wet concrete. You're going to be fine, son. Just breathe. We're taking this slow and steady. Slow. Elena watched the monitor. Webb's oxygen saturation dropped another point. 77. The algorithm of attention pneumothorax doesn't respect protocols or pace. It kills in its own timeline, and that timeline was measured in minutes, not the leisurely assessment Sterling was constructing. The lung on Webb's left side had collapsed completely. Air was trapped in the pleural space, compressing his heart, pushing his mediastinum rightward, suffocating him 1 degree at a time while the attending doctor reviewed imaging that wouldn't arrive for another 4 minutes and wouldn't help anyway because the diagnosis was already written in Webb's gasping breath and the way his skin had gone the color of wet cement. Elena moved closer. Still invisible. A shadow among shadows. She watched Sterling's hands, pristine, soft, the hands of a surgeon who'd been promoted to administrator more for his board connections than for his crisis instincts. He was explaining his reasoning to the room. The imaging will tell us exactly what we're dealing with. We can't just start jabbing around in someone's chest cavity. That's cowboy medicine. He glanced up, suddenly aware of her presence the way a predator senses being observed. His eyes narrowed. The muscle in his jaw tightened. Martinez. Shouldn't you be? But the monitor did something that Sterling's words couldn't prevent. The alarm went from consistent beeping to a sustained wail. Webb's oxygen saturation dropped to 71. The baseline of his blood pressure began its descent toward the cliff edge. 70 seconds. Maybe 90. That was what remained before Webb's cardiac output collapsed entirely, before the pressure in his chest crushed his heart into rhythm failure, before a crisis became a code that no amount of slow and steady protocol could recover from. Elena's hands moved. Not because she'd decided. Because they remembered. Because some muscle memory runs deeper than fear, deeper than protocol, deeper than the voice of a man standing 6 feet away telling her she was exceeding her scope. The 14-gauge needle was already in her hand. She'd grabbed it from the emergency cart without conscious thought, the kind of grab that belongs to hands that have done this before, that know where every piece of equipment lives in the dark because they've had to retrieve it in darkness. Second intercostal space, mid-clavicular line, she said to the room, to nobody, to herself, as she palpated the landmarks on Webb's chest with her left hand, fingers finding the precise anatomical intersection between ribs, between the failure of breath and the return of it. Her fingers had calluses in the shape of medical knowledge. They'd held lives together in places where medical knowledge was all that stood between living and becoming a marker on a memorial wall. 20 years of forgetting didn't erase that. Nothing erased that. The needle went in at a 45-degree angle, deliberate, accurate, the kinesthetic vocabulary of someone who'd performed this maneuver on casualties in the field, intense, in the dark, in the rain. The flesh gave way. The pleural membrane surrendered. And then came the sound that every trauma provider who'd ever lived long enough recognized, the hiss. The hiss of air escaping. The hiss of pressure releasing. The hiss of a lung re-expanding, of trapped atmosphere rushing out, of crisis beginning its transformation into recovery. 70 milliliters. 80. 100. The air poured out like the breath Webb's body had been holding, like a wound that needed draining and finally found its opening. Elena didn't look at Sterling. She didn't acknowledge the way his face had drained of all color, the way his hands had fallen away from the equipment he was supposed to be controlling. She watched the monitor. She watched Webb's oxygen saturation climb like a plane departing. 75. 80. 85. BP stabilizing, someone called out. One of the junior residents, his voice shaking. 90 over 58. 90. 88. 92. Climbing. Webb's color was returning. The desperation in his breathing was becoming respiration. The alarm that had wailed like a siren was now just steady beeping, the rhythm of a heart that had been saved by 40 seconds and the hands that knew exactly where to put a needle when the alternative was watching someone die because the right decision took too long. Elena set the needle down on the sterile field with the same precision she'd inserted it. She didn't explain. She didn't apologize. She didn't make eye contact with Sterling, who was still standing in the same position, his mind still processing how the crisis had resolved without his permission, without his involvement, without the architecture of authority he'd spent 3 years constructing at Sacred Heart. You just performed a medical procedure without physician supervision. His voice was thin. Reedy. A man discovering that the world worked in ways he didn't control. That's practicing medicine without a license. That's a direct violation of hospital protocol and state law. Out. Now. You're finished here. Elena straightened. She looked at Webb, whose eyes were already moving, already searching, already tracking the room with the hyper-alert scan of someone whose body had just been yanked back from a cliff. His chest still heaved, but with oxygen now, with volume, with the machinery of recovery instead of failure. She set down the syringe. The gloves came off in a single fluid motion. She walked toward the door. Behind her, Webb's voice came hoarse and confused. Who did the decompression? The resident answered, but Sterling cut across him, his voice sharpening now, finding its edge as the shock wore off and anger took its place. I stabilized you, son. You're safe now. Rest. But Webb's training wouldn't let the lie settle. His eyes tracked to the doorway where Elena was already moving into the hallway, and something in his brain, some data point from 20 years ago that he'd carried in his muscle memory the same way Elena carried it in her scars, recognized something that he couldn't yet name. No, Webb said, his voice clearing, becoming more aware with each breath of oxygen-rich blood returning to his brain. Those hands. I need to speak to whoever did that. Now. That wasn't protocol. That was. Elena didn't wait to hear the rest. She was already through the double doors and moving toward the elevators, her badge bouncing against her ribs with each step, her heart rate elevated in a way that had nothing to do with the crisis that had just resolved and everything to do with the implications of what she'd done, what she'd been forced to do because protocol would have killed him, because the alternative to breaking Sterling's authority was watching a man die, because some choices don't offer the luxury of selecting the one that doesn't cost. Behind her, inside the trauma bay, Sterling's fingers were already reaching for his phone. His board connections were people who took calls at 4 in the afternoon. People who cared about the violation of institutional hierarchy. People who understood that a nurse performing a physician-level procedure without supervision wasn't just a medical question, it was an existential threat to the structure that kept people like Sterling in their positions of power. He'd seen her competence from the moment she arrived. He'd moved to bury it, to contain it, to establish his dominance. But competence was a living thing. It didn't stay buried. It didn't respond well to being ignored. And Webb's recognizing it, Sterling's mind was already 3 moves ahead, already calculating, already reaching for the mechanisms that would ensure she'd regret the moment she'd touched that needle. The elevator doors opened. Elena stepped into the empty car and watched the doors close on the hallway behind her. On the trauma bay. On the patient whose name she already knew, whose father's faded patch was still sewn into her jacket lining 2 floors below, whose life she'd just saved by becoming the thing she'd been trying not to be since the day she'd left Sangin. Sterling moved through the hospital corridors like a predator who'd just tasted blood. His phone was already in his hand before Elena's unconscious body had been wheeled from the trauma bay, his Rolex catching the fluorescent light as he dialed. Board member after board member. His voice steady, practiced, conversational, the voice of a man simply sharing concerns about patient safety. A nurse performing emergency procedures without physician oversight. Troubling, frankly. Her credentials are thin. Very thin. We should talk about liability. One call led to another. By 7 a.m., investigators from hospital administration were waiting in the hallway outside Elena's locker with a cardboard box and expressions carved from stone. The box was already waiting. Elena knew what it meant the moment she saw it. They approached her at the nurse's station in front of 30 colleagues, the exact timing Sterling had orchestrated, the shift change when the unit was fullest, when the humiliation could achieve maximum diffusion. 2 security officers in pressed uniforms flanked a woman with a clipboard and the tired eyes of someone who'd done this before. Ms. Martinez. The woman didn't offer her hand. You're being terminated effective immediately for practicing medicine without supervision and falsification of credentials. The room went dead silent. Monitors still beeped. Ventilators still wheezed their mechanical rhythm. But the voices stopped. Elena could feel 40 pairs of eyes sliding toward her, then quickly away, the distinct discomfort of people watching someone's life end in real time. She didn't flinch. She didn't reach for explanations. She simply nodded once and began walking toward her locker, the security officers following at precise distance. Sterling watched from the hallway entrance, arms crossed, his face arranged in an expression of concern for institutional standards. He'd already won. He knew it. And he needed Elena to see him knowing it. Her locker smelled like stale coffee and the faint tang of antiseptic that never quite washed out of anything in Sacred Heart. The cardboard box appeared in her hands like a stage prop. Her cracked "World's Okayest Nurse" mug, a gift from a night shift 5 years ago, back when someone had found her worth celebrating. The dying succulent, brown at the edges, that Webb had somehow convinced the ICU florist to let him give her 3 days ago. And the photograph. Faded now. Taken in Kandahar, 2004. 12 faces. All of them smiling. 4 of those faces were crossed out now, black Sharpie lines through people who'd stopped breathing a long time ago. The photograph made a soft sound as it landed in the box, cardstock against ceramic, the whisper of endings. She could feel Sterling's satisfaction from 3 corridors away. The walk to the exit took 4 minutes. Long enough to pass the ICU where Webb lay, unconscious, his trauma fully stabilized now, her work done and unsigned. She didn't look through the glass. Past the break room where she'd eaten lunch alone for 3 years, her cold coffee growing colder. Past the medication dispensary where she'd watched the younger nurses laugh about things she'd forgotten how to laugh about. The sliding doors opened onto Portland's perpetual grey. Rain hammered the ER bay like small fists against the windows. The bus stop was 6 blocks away. Elena made it there without stopping, the cardboard box growing soft in her hands, the rain streaming down her face in a way that might have been tears or might have just been weather. The photograph floated to the surface of the box, its plastic sleeve fogging. She could see her own face in that picture, younger, scarred differently, unbroken. The woman looking back at her was a stranger. She reached into her jacket lining and found the patch. The faded unit insignia, worn silk the color of old blood, the stitching her own hands had done on a cot in Kandahar when she couldn't sleep and couldn't move and couldn't be anything but what she was. It felt heavier than her regrets. It felt like gravity itself. A bus arrived. The doors hissed open. The driver waited, one hand on the wheel, watching her with the particular kindness of people who'd seen wet women at bus stops before. Elena didn't move. Behind her, 3 blocks away, inside Sacred Heart, something was changing in ways she couldn't see yet. Webb had deteriorated overnight. Not medically, his oxygenation remained stable, his vitals well controlled, the ticking of his monitors a metronome of survival. But mentally, he'd begun an ascent into agitation that concerned the residents. He kept asking for the same person. The nurse with the fast hands. Where's the nurse? His voice hoarse, urgent, the inflection of someone used to being obeyed. I need to talk to her. Sterling deflected with practiced ease. She was just covering. Another nurse will, no. Webb's eyes locked onto him with the particular intensity of men trained to read threats across open terrain. Specific nurse. Elena. Elena Martinez. She pulled me out when I was 7. Sangin. The schoolhouse. She saved me then. She saved me yesterday. The attending froze mid-note. A nurse glanced up from her charting. The words landed like a detonation. No one moved. The ICU attending, Dr. Patricia Reeves, had worked at Sacred Heart for 17 years without her hands shaking. They were shaking now. She walked, not ran, but moved with precision, to the records room. The personnel file had been sealed, marked for destruction per protocol, Sterling's handwriting on the directive. She opened it anyway. Past the termination paperwork dated today, 7:04 a.m. Past the performance reviews written in Sterling's neat block letters, each one constructed like a logical argument for why Elena Martinez was fundamentally unsuitable for medicine. Down to the bottom, where the original documents remained, filed but not yet purged. The DDL 214. Her discharge document. Her voice cracked reading the first line aloud in the hallway where staff was beginning to gather, drawn by Webb's insistence, by his rank, by the weight of a Navy SEAL patient saying a name with the reverence of someone naming a savior. Senior Chief Petty Officer Elena Martinez. Murmurs rippled through the crowd like aftershocks. A resident flipped the pages with shaking hands. Naval Special Warfare Group. Combat Medical Specialist. Sangin Province, Afghanistan. Multiple deployments. Someone whispered, Someone else dropped a pen. The crowd was growing now, 40 people, 50, the shift change bleeding into crisis, every available person drawn by gravity toward this moment. The hallway filled with the sound of shoes on tile, the soft rustle of movement, the particular hum of shock moving through a crowd. The attending's voice dropped to a whisper. 2 silver stars. She paused. The page made a soft sound as she turned it. And a Navy cross. The hallway went completely silent. Someone gasped. Someone dropped a clipboard, and the plastic binder clattered against the floor with a sound that echoed like a shot. Then came the other sound. Distant at first, then growing. Rotor wash. A helicopter, its blades cutting the Portland rain into horizontal slices. Boots. Moving fast. Not hospital shoes, not the soft tread of nurses or the measured pace of doctors. Military boots on tile, 4 of them, each impact precise and synchronized. The rotor wash grew louder, shaking the windows now, water streaming down the glass like the hospital itself was crying. The sliding doors burst open and a Navy SEAL commander stepped through in dress uniform, the blue of his service dress sharp against the hospital's white, ribbons blazing across his chest like proof of a life spent at the edge of things. 3 more SEALs flanked him, water dripping from their uniforms, their presence changing the air pressure in the hallway. Sterling stepped forward, his face already beginning its shift toward damage control. There's been a misunderstanding. That woman was terminated for. The commander's voice cut him off. For words. Surgical. Doctor, you just fired one of the most decorated medical specialists in naval special warfare history because you felt threatened by her competence. Sterling's mouth opened and closed. The commander held up a tablet, the screen glowing with official letterhead. Senior Chief Martinez is credited with 43 combat saves. She trained half the special operations medics currently deployed. Her call sign was Angel Actual. A nurse gasped. Someone in the crowd whispered, "Oh my God." The commander's eyes moved across the assembled staff with the particular focus of someone used to reading rooms for threats. She walked away when PTSD made her a danger to herself and her team. She chose obscurity. Healing. And you punished her for saving a life. Sterling's face had gone the color of institutional walls. The hospital president arrived at a run, phone already in her hand, his board connection suddenly unreturnable calls. Security officers who'd been walking Elena out, those same officers, were now flanking Sterling with different intent. The commander's voice rose above the chaos of the moment. Where is she? The hallway had no answer. No one had thought to follow Elena past the sliding doors. No one had watched her walk into the rain with a cardboard box and the weight of invisible medals. Webb's eyes opened at 11:48 p.m. Not slowly. Not confused. Alert. Combat aware. The ventilator hissed its mechanical rhythm beside him, but his hand moved to pull it away, muscle memory overriding medical protocol. A resident attending froze, for bag suspended mid-hang. Webb's voice came out hoarse, fractured, but unmistakably command level. I need to speak to Senior Chief Martinez. Now. It's not a request. The resident blinked. Sir, you're just waking up from. Now. The attending's hands trembled as she reached for Elena's file. 3 weeks of sealed paperwork tumbled across the counter, the termination notice stamped in red, the investigation summary, Sterling's typed accusations bleeding into each other like ink in rain. Then her fingers found it. The D-Deal 214. Discharge papers. The attending's breath caught. 2 silver stars. Navy Cross. The words printed in bureaucratic black and white, each one a sentence the resident attending had never learned to read. She pulled the document closer, rereading the name at the top as if repetition might change what she was seeing. Elena Martinez. Senior Chief Petty Officer. Honorable discharge after 20 years of service. The attending's colleague appeared at her shoulder. Then another. Within 60 seconds, 30 staff members had gathered in the hallway outside the ICU, their understanding of the quiet nurse who'd been escorted out during shift change fracturing and reassembling into something entirely different. The attending's voice cracked as she read the citations aloud, her eye scanning each line as if the words might burn. Exhibited exceptional courage under fire in Sangin Valley, Helmand Province, 2009. Coordinated emergency medical evacuation during active firefight. Saved the lives of 7 personnel under conditions of extreme risk. She paused. The hallway held its breath. Navy Cross for extraordinary heroism. Silver Star for gallantry in action. Another Silver Star for meritorious service in combat operations. The paper shook in her hands. Around her, nurses who had avoided Elena's table in the break room, who had accepted Sterling's subtle reinforcement that she was difficult, uncollegial, safety unconscious, they understood now. They had been standing next to a legend. They had watched her be fired for saving someone's life. The SEAL commander arrived at 12:43 a.m., less than an hour after Webb's demand. He moved through the hospital like water finding a downslope, precise, inevitable, unconcerned with architecture. Full dress uniform. Rows of medals on his chest that caught the fluorescent light like they were made of promises. He bypassed the administrative office entirely, walked past Sterling's closed door without a glance, and went directly to the ICU where Webb lay stable now, O2 sat 97%, heart rate normalized. The commander placed a hand on Webb's shoulder. Webb saluted from the bed, a gesture both men understood. Senior Chief Petty Officer Elena Martinez is being recalled for a crisis medical advisory mission, the commander announced, his voice the kind of calm that comes from having already survived the worst. The hospital president materialized in the hallway. Security straightened. Her specific combat trauma expertise has been requested by JSOC for a 6-month rotation. She leaves immediately. The Navy will handle all administrative matters. Sterling emerged from his office. His face had already begun its descent into something smaller, meaner, the expression of a man watching his infrastructure collapse in real time. There are proper channels, he said. His voice sounded like cheap fabric tearing. Personnel records, licensing boards, I have documentation that she. The commander turned to him with the expression of someone noticing a mosquito. Doctor, you just fired one of the most decorated medical specialists in naval special warfare history because you felt threatened by her competence. You withheld pain medication from a patient under her care and then punished her for objecting. You activated your institutional network to orchestrate her termination based on medical jealousy. The commander's voice never rose. It didn't need to. The Navy is not interested in your channels. The hospital president's phone buzzed. Then again. Then in rapid succession, his board members, his legal team, his insurance carrier. All calling. All asking the same question, why didn't our physician know what he was firing? Sterling tried to interject again, something about policy, about scope creep, about the board's initial support, but the president silenced him with a gesture that looked almost gentle. Almost. My office. Now. Security approached Sterling as he moved toward the president's door. Their presence made the decision obvious. Badge and access card were requested. Surrender, not removal, the distinction somehow worse. Sterling complied with the mechanical precision of a man whose brain had already understood what his mouth refused to say. The walk back down the corridor was the same one Elena had taken 6 hours earlier. Past the same rooms. Past the same staff who now understood exactly who they'd been watching be destroyed by a man insecure enough to fear a nurse's competence. But where Elena had carried a cardboard box and her dignity, Sterling carried nothing except the weight of his own miscalculation. His phone started buzzing before he cleared the hospital doors. Medical board inquiry. State licensing investigation. Former colleagues at other institutions claiming they'd always had concerns about his judgment but had never wanted to interfere. His board connections, the ones who'd taken his calls, who'd signed off on his characterization of Elena as problematic, were suddenly unavailable. One called back to say he'd recommend Sterling's immediate and thorough psychological evaluation. The network that had felt so solid, so institutional, so permanent, dissolved like salt in rain. 6 months passed. Elena never returned to Portland except once, to retrieve the faded unit patch from the hospital break room where she'd left it sewn in her jacket lining. The nurses had framed it. Actually framed it, mounted it on the wall in the break room with a printed photo of Elena in full Navy dress, medals visible, surrounded by her SEAL team. Underneath, in careful handwriting, "True class is what you do when the lights go out." Coffee steamed. No one left when the quiet one sat down anymore. By month 4, Sterling's license had been suspended pending investigation. By month 5, he was teaching CPR to community college students, minimum wage, to people who didn't know his name used to mean something. His office at Sacred Heart had been cleared by maintenance staff who'd packed his personal effects without the courtesy of his presence. Colleagues didn't call. Former mentees removed his name from their publications. The institution that had reinforced his authority for 15 years had simply moved on, filling his position with someone competent enough to run a trauma department without needing to destroy the people beneath them. Reed Army Airfield. 6:44 a.m. The tarmac stretched empty except for the helicopter, a CH-53K King Stallion, its rotors already spinning, maintenance crews completing final checks. Elena stood on the concrete in crisp Navy fatigues, the weight of her uniform familiar and strange, like stepping back into a skin she'd shed but never forgotten. Her scarred hands gripped her duffel. The faded patch was pinned to her chest now, visible, official, no longer hidden in jacket linings. Webb approached from the crew staging area, fully heeled, in dress uniform, medals aligned like a prayer. He carried something wrapped in plastic. The unit patch, his father's patch, the faded one Elena had kept safe for 20 years. The one she'd carried through 3 years of obscurity, through humiliation, through the rain-soaked night when she'd stood alone at a bus stop wondering if anyone would ever know her name. Webb extended it without speaking, then carefully pinned it to her uniform beside her own. The gesture was a salute before the salute came. He stepped back. His hand moved to his forehead. She returned it, and in that moment, the boy she'd pulled from a collapsed schoolhouse during a firefight and the man he'd become understood each other perfectly. "Welcome home, Senior Chief," Webb said. His voice carried the same command tone as his father's had, carried it the way Elena had taught him to carry medical knowledge, not as power, but as a promise. The helicopter blade screamed overhead. The team of young medics, her students now, the one she'd trained for the past 6 months, stood at attention. Elena boarded without looking back. But as the aircraft lifted and Portland began to shrink beneath her, she allowed herself to see it, Sterling's office, empty and dark. Sacred Heart's trauma bay, staffed by nurses who finally knew her name. The break room wall where her photo hung. The helicopter rose higher, and Elena touched the patch on her chest and permitted herself to smile, the smile of someone who'd been underestimated so completely that her victory felt like a secret kept from the entire world. If you've ever been judged by someone who had no idea who you really were, if you've ever bitten your tongue and waited for the truth to come out on its own, Elena's story is for you. Subscribe now for more stories of hidden strength and impossible comebacks. Like this video if you believe true power is the ability to help. And comment, what would you do in Sterling's position? Would you recognize the legend standing in front of you?